Anthony Davis on this play suffered a left hand injury that confirmed to be ligament damage with potential surgery upcoming. The reports say that he could be sidelined for up to a few months with this injury. My name is Ryan, I'm a physical therapist. I'm going to run through exactly what I saw in this play here and kind of go over some of the mechanism of injury, the anatomy behind this, and potentially recovery for Anthony Davis's left hand. So if we take a look at the play of when the injury did happen, we see that Anthony Davis's left hand gets kind of stuck while he's trying to guard Lauri Markkanen as he's driving to the basket. It gets stuck between kind of his basically upper arm here, and you see his fingers kind of get jammed as Lauri Markkanen is driving. And immediately afterwards, you see Anthony Davis is in pain and kind of gingerly holding on to, or bracing that left hand here. So going back to the play, you kind of see there's not the best angle of what exactly is going on with the hand. You kind of see him maybe potentially trying to hold on to Lauri Markkanen as he's driving. And as he's doing that, I believe his fingers go into straight extension or severe hyperextension. And this probably gives you a good angle. This is what I believe what his fingers look like when he is trying to stop Lauri Markkanen, which caused the injury. We have severe hyperextension of that those knuckle joints, which are those metacarpal phalangeal joints. As well as you can see at the fingers, there is some flexion there. So you're thinking that he is flexing those distal or proximal interphalangeal joints. And as we pause the video here, we do see that he's holding on to that palmar region, applying some pressure, which is most likely whereabouts that injury did happen. So maybe not near the wrist, but definitely could be involved more of where those MCP or knuckle joints are at, and potentially more distally at your interphalangeal joints. So we'll break down this anatomy now and kind of give you a rundown of what could be potentially involved with Anthony Davis's injury. So the wrist and hand is a very complex anatomical region with a variety of different structures, including bones, tendons, ligaments, and joints. We have two sides. We have the palmar side, so when the palm is facing up, as well as we have our dorsal side or the back side of the hand. We remove a lot of the muscles here. It gives us a better view of all the bones and the joints of that hand. So we obviously have our carpal, our 8 carpal bones seen here that make up the wrist. These extending out to your metacarpals, which are these long palm bones here. And then these all come into making into our fingers, which create our distal interphalangeal joints and our proximal interphalangeal joints seen here. So things we have to consider include like fractures within the wrist bones or anything, any of the bones that help create the fingers, potentially tendon damage of these muscles that help connect from the muscle and then go and insert down towards these fingers, as well as any muscle strains, maybe potentially with the inside muscles that we have within our hand anatomy. There is already reports saying that he has suffered ligament damage, so we'll go over that specifically, but maybe other injuries that could potentially happen with this type of mechanism of injury that Anthony Davis did sustain. So first we'll take a look at the dorsal portion of the hand. The primary muscle that comes from our lateral epicondyle or lateral part of the humerus or elbow includes the extensor digitorum. This is this giant muscle here that is highlighted, and it goes and inserts at its specific points of the fingers. One injury that could happen with this type of tendon tear would include a mallet finger. This is going to be seen more at this distal IP joint, so distal interphalangeal joint seen right here. Specifically when that extensor tendon is torn and it leads to that distal IP joint to kind of sag downward, or it's unable to extend up. Another injury that would be considered would be maybe a part of this palmar side, which would include your flexor digitorum superficialis or flexor profundus. Superficialis is seen more superficial. It's highlighted here. Very similar anatomy, way it runs through the body, goes to from more of that medial side of the elbow now, and goes and inserts at its specific points of the fingers. And then the profundus is seen more deep, and that goes actually more distally, but also primarily does the same thing, helps with assisting with flexion of those finger joints. This would be called like a jersey finger, so that's when that flexin tendon tears from the bone at the fingertip when the bent finger gets caught and forcibly straightened, which was seen with Anthony Davis, often when trying to hold the opponent's jersey, which again was kind of what the mechanism of injury was, what Anthony Davis was trying to do. This is more surgically managed, so this would take a little bit longer time for recovery if this is what Anthony Davis did sustain as well. And then to bring more complexity to this type of injury is all the ligaments that help support and stabilize the hand and the wrist joints. As you see here, there are a variety of different ligaments that could have been sustained with tears. That was definitely confirmed of the injury of what Anthony Davis did sustain. Ligaments are parts of connective tissue that help connect bone to bone. They play a vital role in stabilizing the joint and facilitating smooth motion. Due to what we know right now, it is confirmed that there is ligament damage, and this could take months for recovery. We have a variety of different grades for ligament tears. We have that grade 1, grade 2, and grade 3. Grade 1 being the least severe, grade 3 being a full tear of those ligaments. With the grade 1 maybe even taking 2 to 6 weeks. Grade 3 being a full tear that requires surgical intervention, and that could take up to 6 months plus for a full recovery. Unfortunately for Anthony Davis, he's just unable to stay healthy, especially as he continues to age in his career. I would say the good thing about this is his left hand, so it's not his dominant hand. However, with these type, even though it doesn't seem like a very severe with the hand injury, these things can be very painful, very discomforting. And with swelling and bruising and all that, it really can cause an impact on his play. You hate to see this for any type of NBA player, especially for Anthony Davis, that he's just trying to get back and play and be healthy for the Dallas Mavericks. However, we are hoping that he does have a speedy recovery, so he's able to get back hopefully sometime this season, but there's just too much little information known about this type of injury at the moment. So we'll hopefully find out more as he goes sees a hand specialist soon. That will hopefully diagnose him and give him a good recovery timeline. Hope you learned a little bit about the anatomy behind the complex area of the hand, fingers, and wrist, specific joints that help move, the muscles, tendons, and as well as the ligaments that help support that surrounding anatomical area. Let me know if you have any questions down below, and thank you so much for watching.